Imagine you're a contact sports player, a car accident survivor, military, or maybe you just slipped on some ice and hit your head. You walk it off, maybe feel a little foggy, but after a few days, you figure you're fine. But weeks pass, and something's off. Your head still aches, you're exhausted for no reason, your memory's a mess, and loud noises make you want to hide under a blanket. What's going on? This is where chronic post-concussion syndrome, or PCS, enters the story. Chronic post-concussion syndrome is a condition where the symptoms of a concussion, like headaches, dizziness, trouble concentrating, memory problems, and even mood swings, don't just go away after a few weeks. Instead, they stick around, sometimes for months, sometimes for years. And it's not just a lingering headache. It can affect your personality, your ability to work, your relationships, and even your sense of self. A concussion is essentially a brain shake. Your brain, soft and fragile, slams against your skull. This damages tiny nerve fibers and disrupts communication between different parts of your brain. Most people recover in a couple of weeks, but in some cases, the healing process stalls, leaving you stuck in a loop of symptoms. People with chronic PCS can feel like they're living in a constant brain fog. Imagine trying to think through cotton, words slip away, concentration breaks, and even simple tasks like following a conversation feel like running uphill. Headaches can come daily, often with dizziness or balance problems. Lights and sounds that never bothered you before suddenly feel unbearable. And the emotional side? Anxiety, depression, or unexplained irritability, as if your brain's stress dial got cranked up and won't turn down. So, who's at risk? Athletes, sure, especially in contact sports like football, soccer, or hockey. But car accident victims, military personnel exposed to blasts, and even people who slip and hit their heads at home can end up with PCS. Sometimes the severity of the hit doesn't even match the symptoms. A mild concussion can lead to severe, long lasting problems. The reasons vary. Sometimes the brain doesn't heal properly. Sometimes inflammation gets stuck in overdrive. And sometimes pre existing mental health conditions or multiple concussions add fuel to the fire. The good news? There's hope. Healing from chronic PCS isn't fast, but it's possible. A combination of therapies works best. Vestibular therapy can retrain balance and dizziness issues. Cognitive therapy helps with memory, focus, and processing speed. Lifestyle changes, sleep hygiene, gentle exercise, and reducing stress help your brain find calm. Nutrition plays a big role too. Anti inflammatory diets, rich in omega 3s, antioxidants, and healthy fats, help reduce brain inflammation. Mind body practices like meditation, breathing exercises, and even light yoga can help calm the overactive stress response in your nervous system. Most importantly, patience. Brains heal on their own timeline. For the people that know our story, my husband Rob has chronic post concussion syndrome. This is a long term issue that we deal with. You're not alone if you or someone you love is still struggling months after a concussion. It's not all in your head, it's a real physical condition. With the right support, understanding, and tools, healing is possible. Please like and follow for more great content